What's up, everybody? Welcome into the Performance Medicine Show. I see D. Lynn's here. Thank you. Thank you for the love, D. Lynn. Smash the like button. Share the broadcast. We appreciate you guys. We're going to let a few people come in. For all the new people, welcome. For all the regulars, we love you. Thank y'all for hanging out with us tonight. We've got a wonderful show coming up. Lots of great questions that came in throughout the week. Looking forward to getting to all those. Mark, what's going on, man? I owe you an email. I know I do. Great to see you. Stan, hello. Thank you for hanging out with us tonight. Any first timers here? Frida, hello. Happy Tuesday to you. Thinking of like a Taco Tuesday, Performance Medicine Show Tuesday. Taco Tuesday just sounds good. I'm not going to have tacos tonight. Lisa, thank you for sharing. Thank you for being here. Roel, hello. Rita, what's up? Great to see everybody. Thank y'all for hanging out with us. Deborah, what's going on? Like I said, welcome to the Performance Medicine Show. This is where we answer your health and wellness questions. We're going to get Doc here in just a bit. Michelle, what's going on? Great to see you. Great to see you. My brother Steve, good evening to you. Robin Riddle, the star of Explain This. What's going on? You can also find her in West Knoxville in Franklin Square at our West Knoxville office. Happy to have you in here, Robin. Let's see, Margot, what's going on? Yes, bring some tacos. You can find Margot in our Fountain City location, which is where I'm at the moment, right across from Litton's. Might have to go get some Litton's here in a minute after the show. Tabitha, you can find Tabitha in Kingsport. You know you can. She's one of the beautiful faces you'll see as you walk in the door in the White House in Kingsport. Welcome in. So pumped to have everybody with us tonight. We're going to go over, we had an unbelievable day with Performance Weekly. Speaking of Robin Riddle, we had a doozy of a Explain This episode on the MTHFR gene. In this episode, Robin breaks it down for us. And I have to say, I might have gotten lost about twice in the show. And I think Robin could tell. She was like, Ben, I lost you, didn't I? And we had to go back. But my hope, and I know Robin's hope, is that for all those who watch that episode, understand this gene mutation a little bit better. It is way deeper than I realized. And it's a marker on our Cleveland Heart Panel. And we talk about the MTHFR gene quite a bit. So definitely check out that episode. The Common Sense MD was on emergency. I think Roel it was that asked about CPR. So we did an episode on it. Not only CPR, but also we talk a little bit about the Heimlich maneuver. We talk about the ABCs of emergency, I believe. Really cool episode in terms of just some basic stuff we think that everybody should know if they're around an emergency situation. And on Outside the Box, we had Kate Palmer from Flourish Concierge Physical Therapy in Johnson City. We talked specifically about pelvic floor physical therapy. Really, really interesting episode. I had no idea how important the pelvic floor was for everybody, not just women, for men as well. So definitely check out that episode. It was extremely eye-opening for me. So thank you to Kate for hopping on the show. I see Doc's about ready to go. Thank you guys for hanging out with us tonight. We're going to get to all these questions. That's right, Robin. I think people might need to watch that a couple times. I completely agree. Jack, what's up? I'm going to put this up from Montana. You can normally find her in Franklin Square in West Knoxville, but Fountain City if there's tacos. So I'm right there with you. I follow the tacos. Katie, what's going on? Great to see you. Thank you for being here as always. All right, we got a wonderful show heading up for you. Doc, you ready to roll? Let me get these questions here. What's going on, man?
Hey, Ben. Good. How you doing?
I am wonderful. Did you get to take a walk today?
Yeah, I did. I took 2 walks today.
It was gorgeous. I tried to walk a little bit before we went live tonight, and it's getting a little colder.
Yeah, it's a little colder tonight. At lunch, it was really nice. I did get a little workout in the morning and got in the infrared sauna. So I actually had 3 workouts today.
Look at you, and I
So
can
I
tell you
worked
can.
a full day.
You look lively. It must be all
I
the exercise you're getting.
I don't feel lively tonight, but
How's the day at the office? Y'all have a good day?
yeah, we had a very busy day. Very busy day.
Let's see here. Are you ready to jump right in? Because we got a ton of questions that came in through email and through our
Yes.
social accounts. So
Yeah.
let's jump right into it. You ready?
Yeah.
All right. Click and record here. As you guys know, we put this up. We put a recording of this on the Outside the Box podcast about a week later. So let's go ahead and get started here. This came in over email. I saw the Wall Street Journal article about the uptick in colon cancer in younger ages, often at advanced stages due to no symptoms.
Yeah.
In light of this, do you recommend that we push our PCPs for some other screening tests in the long tenure span between standard colonoscopy starting at 50? Great question. What's your thoughts on this?
Great question. Yeah, they've gone from recommending you start colonoscopies with no risk factors at age 50 to age 45, which it does seem like we're seeing more colon cancers in younger people, and it's usually worse. So yeah, I mean, 10 years is a long span to go. So what I recommend, if you have it, you probably ought to start at 45. I mean, it's an easy test. At least get a baseline colonoscopy at 45. And if it's clear and you have no family history of colon cancer, you might consider getting a Cologuard in 5 years. Cologuard picks up a lot of colon cancers. I think like at least 92%, probably a little bit higher. As a matter of fact, when I saw an article or a little vignette of one guy that was talking on the news one night about it, how they picked his up, and he was at 45. He actually got a Cologuard stool test, and it was positive. So then he went and got a colonoscopy, and they found his colon cancer, which had already spread through the walls. So actually, the Cologuard was what saved his life. So I like the Cologuard as well as colonoscopies. So I'd probably get a baseline colonoscopy at 45. And then if it's normal, get a Cologuard in 5 years. That's totally coming from me because, 10 years is a long time to wait. And, what they don't know is why we're seeing these increased factors. I assume it has to do with diet, in my opinion. And I really don't think it has to do with red meat either. But, you should eat fiber, drink water, exercise, stay lean, watch alcohol, do all those other things that are risk factors for heart disease as well as cancer. Because out of all the screening tests, I think colon cancer is the one that's the most preventable. I've seen some horrible colon cancer deaths that were completely avoidable if they'd have gotten a screening colonoscopy. So it's tragic, really. So at least get a Cologuard, but get that baseline colonoscopy and stay tuned and eat a better diet. Stay away from, a lot of bad poultry. Always eat organic, grass-fed poultry, especially.
All right. Thank you for that question. I love questions that come in around things that they've read recently and outlets like the Wall Street Journal, because one, I know you read the Wall Street Journal
Every day.
regularly, and it is kind of fun to talk about, things that are out in the mainstream, bring it in here and kind of make it practical for everybody. So thank you for
Yeah.
that
That's a great
question.
comment. Great comment. Yeah, I think I'm big on screening test.
Yeah.
You know,
All right.
you
Let's
get
get
hints
here.
too, or any other symptoms, weird symptoms that don't go away, get it checked out.
While we're on that topic, because I'm sure some people are thinking this, screening tests off the top of your head at 45 and 50, colonoscopy. I know you're
See,
going to talk about mammograms for women. Anything?
mammograms, prostate checks, PSA is not the greatest test, but I still use that, and the prostate check, the finger wave, although that's controversial, I still do it. I mean, you may discover colon cancer as well, or rectal cancer, through that little 5-second test. So I still believe in that. Of course, mammograms or thermograms, if you prefer. CT calcium scorings of your heart, and it also scans your lungs, a Cleveland Heart Panel. Those are the biggies that I think about, as well as a physical exam, at least every couple of years.
All right, let's get to the next question here. This is around psoriasis. Psoriasis patient, what supplements do you normally recommend?
Psoriasis is one of those autoimmune things. Your body I think of it as your body reacting against its own sweat. Psoriasis is really a more severe form of eczema, which is similar. The rashes, psoriasis occur in little different spots on the body than eczema. Eczema usually follows the inner part of the limbs. Psoriasis is on the elbows and knees. The others are on the antecubital fossa that we call. But and psoriasis gets plaque-like. It's worse, in my opinion, but it's still an autoimmune thing. So you got to think about your diet first. The first thing I would do is get on an autoimmune diet, which means make sure your gut's working well, eliminating sugars and glutens and dairy and nightshades and corn and soy. And then, of course, balancing your gut. As far as a prescription medicine, I like low-dose naltrexone for psoriasis patients. And try to figure out what the trigger is, the trigger for flares. I like curcumin as an over-the-counter supplement. That's probably my favorite one. There's just not a lot of over-the-counter stuff that really will wipe it out. I like CBD oil for it as well. So that's a toughie. You got to look systemically for that. There's not one good wipe it out supplement that I typically use for psoriasis, maybe besides curcumin. It usually takes something a little more potent. But try to get to the root of the problem. That's what we try to do with functional medicine.
All right. Thank you for that question. Came in on Instagram. Welcome in everybody to the Performance Medicine Show. Those who are showing up, thank you guys so much for hanging out. I see Elena's here. Great to see you. Let's get to this question here. This was new for me. I did not know anything about this actually, so I'm really pumped that this came in. What are your thoughts on the Xiosted testosterone auto injector for TRT? Do you know what is that?
I don't think I've ever prescribed it, but I've been detailed on it. And it's just an auto injector pen with testosterone. Actually, it's testosterone enanthate, which is a good form of testosterone. We usually use cypionate. I think we use a lot of enanthate as well as a blend of both. But a lot of people that have acne or they just have other side effects from that they don't like from testosterone cypionate shots I'll switch them to a Nanthate, and they usually improve. It's more expensive than Cypionate, so sometimes I have to order it. But the pen, the auto injector, really is, it's a subcutaneous auto injector with a smaller needle. You do it sub-Q in your abdomen, and it is a Nanthate, not Cypionate. So it's easier. The smaller needle, you just pop it on. It's single-use auto injector. It's kind of like the Ozempic pen or Wegovy or some of those Mounjaro, but it's testosterone. There's no generic in it, so it's really expensive. So the idea is okay. We use a lot of sub-Q testosterone. You don't have to inject it intramuscularly, which is the usual route, but sub-Q is okay too. It's just a kind of a unique form of testosterone and Nanthate that's expensive, but it's in a pen for people that may not be able to draw up the testosterone on their own, or don't want to come in for shot or pellet. So, I mean, it's out there. I don't see insurance covering it. I just don't think they'll cover it really too much, but maybe I'm wrong about that. But so it's just more of a boutique way of getting testosterone and Nanthate through an auto injecting pen. So it's really interesting.
Is there
Really
like a pharmaceutical company behind that?
Yeah. It's
Interesting.
a branded. Yeah, it is.
Wow. So it is a
I
lot
don't know
like
the name of the pharmaceutical company, but yeah, it's a branded testosterone pen.
Man, thank you for sending in that question. That's awesome. Let's go to, I don't know if you're wearing yours now. You normally are. There it is.
Oura ring.
I noticed you wear an Oura ring. So do I. What is the most important data it gives? Heart rate variability ?
Yeah, that's one of the biggies for sure. The reason I like it so much is because of sleep patterns. Being an old doctor who's taken call for years and gone back to the hospital, don't do that anymore, but did for years and years. It gets your sleep cycle out, and you have sleep problems, I think, because of that the rest of your life. At least I have. So I really wanted to look at my sleep patterns. So it's great for sleep. Your sleep latency, the time from when you lay down to when you actually sleep, is on there, and then it records your phases of light and deep sleep, like delta and REM sleep. Tells you how often you awaken. Certainly, this new Gen 3 that I have tells you oxygen saturations, breathing irregularities, so you can kind of get a clue as to if you may have sleep apnea. But also heart rate variability at night when it's most important. Heart rate variability is a really good measure of your cardiovascular fitness and how you're doing. So I really notice a difference when I'm working out real hard. My heart rate variability goes up, which is what you want. It's that, micromillimeter difference in heartbeats. It should be different. And at night, the higher it is, the better it is. So I've certainly been able to experiment with different things and get feedback on it. For example, different sleep products that I'll use to see what kind of sleep it gives me. And also exercise patterns, doing more cardio improves my heart rate variability. It takes your body temperature at night, so it can kind of predict, when you're getting sick. I remember when I had COVID the first time, my body temperature was up 2 nights before I actually came down with any symptoms at all. So I knew something was up. Also, for women, it can predict ovulation, and it tracks your walks and how intense your exercise is. It's just a wonderful thing. It keeps getting better. I love my Oura ring. It's my favorite wearable fitness device. I love my Oura ring. A lot of athletes wear them.
Super cool. Super cool. I didn't realize that about the body temperature, but I had heard a lot of people had like, uh, kinda noticed or knew that like a sickness was coming on based on their,
Yeah.
uh, Aura results. Super cool.
Yeah.
All right, let's move on to the next one. Reminder to everyone who's with us live, if you have a question for Dr. Rogers, go ahead and put in the comments. We're going to get to that here in just a couple minutes. Let's go to this one here. I've been working for a full year on getting my estradiol up to a minimum of 30 for bone health, and preferably even higher as you like to see it. Both progesterone and testosterone levels came up just fine as soon as I started BHRT, yet even with several prescription adjustments, the highest estradiol has gotten is 17. Question is this level of 17 doing anything at all for bones and overall health, or has this entire year just been non-productive? Note, pellet is not an option, so they're using the creams here. So
Yeah.
what's your thoughts on this?
That's a good question. I see that a lot. It's a little harder to get a blood level of estrogen than it is testosterone or progesterone. And some people don't absorb the estrogen as well. One thing with creams, if you're really consistently after several dose adjustments, one thing is if you're not absorbing it, instead of the 80-20 usual mix of estriol to estradiol, I'll do a 50-50 and see if that helps work your dose up a little bit. And then if I'm still not getting a result, I'll check a salivary hormone panel just to see if you're actually getting a better tissue level. So sometimes I'll do that if I'm kind of can't figure out why you're not absorbing the estrogen. But that's a common thing that I do see. No, I mean, you're still getting progesterone and testosterone, and you may in fact be getting more estrogen than you think if you do a salivary test. So I mean, definitely don't stop it. Keep doing it and kind of working with it. Maybe even consider getting um, a salivary test to see where that is. The pellets are my favorite. Whenever I can't get a level on with creams, I can always get a level with pellets. But as you know, I don't like oral estrogens or testosterone. Some people use them. I just don't. The only oral I like is natural progesterone. I will use that sometimes, especially if you have a sleep problem. Give it at night. So that's what I would do. I'd like to see the levels you're on, but maybe if they haven't tried a 50-50 mix on the biased. Remember, there's two types of estrogen in there. Then use a 50-50 and, up it just a little bit and maybe check a salivary test to see kind of where you are more from a tissue level. So, but no, keep it up.
And it
Definitely
does seem that they're using straight 100% estradiol.
Yeah, you might switch that up a little bit and use I usually use biased, which is a mix of estradiol and estriol. So you might want to just go to that and try that. Again, remember when you put creams on, don't put it on top of lotions because sometimes that'll affect the absorption of it. But yeah, you probably need to try a different cream, maybe check a salivary level and see where you're at, but definitely don't quit doing it. I guarantee you're getting good stuff from that.
All right, great question there. This question is going to be about tick bites, which we haven't talked a lot about as of late. Is there anything natural that's effective for tick prevention, or is DEET safe to use? Are there any nutritional supplements that would help in repelling ticks? And then we'll once we get to this one, we'll talk about treating a tick bite, which is a follow-up question. What's your thoughts on this?
I don't know of anything that's really natural for tick prevention. I mean, I've tried all kinds of stuff for ticks and mosquitoes. Natural, just doesn't seem like any of them work. You have to really just check yourself every time you go out. If you're in an area that's endemic, if you're out in the woods a lot or grasses, You know, I don't like DEET a whole lot. I know it's the only thing really effective for it, but there's some bad things with DEET as well. Of course, you don't want to get any of the problems that can arise from tick bites too. I wish there was something really good out there besides wearing long pants and long sleeve and checking yourself afterwards. But I just hate to recommend something I don't think works very well when it comes out. If somebody would get something like that would repel ticks and um, mosquito bites. I mean, a lot of people use all kinds of stuff like citronella and all kinds of things. None of them seem that effective to me because I've tried a ton of them. I have more problem with mosquito bites than I do ticks, but um,
That's something I'd like to, ask the people live with us tonight. If you guys have any suggestion, anything that you have seen work, we'd love to put those up on screen, either for ticks or mosquitoes. Things that are kind of safe that you guys
yeah, maybe
know
some of
of.
the naturopaths that listen
Yeah.
in, they've got some stuff that may be effective. I just haven't found any personally, but
So, what is the best way to treat a tick bite? Do you recommend taking a couple of doxycycline after a tick bite?
yeah,
What's your thoughts
I
on this?
do. I do. If it's been embedded, you get any redness, I wouldn't take a couple. I'd take it for a week.
Hmm.
Um, but I'm more of a preventer because if you go through all the testing, you have to get blood tests twice. And especially if you're Rocky Mountain spotted fever, which can be fatal, go ahead and treat. It's a safe medicines. We use it for acne for years. So I use a lot of Doxy. That's another thing you ought to have in your medicine kit is some doxycycline as well as a Z-Pack. But if a tick's embedded, use tweezers and pull straight out is the best way to get the whole thing out, in my opinion. And then clean it with soap and water. Maybe use an antibiotic ointment like Bactroban is my favorite because you can get a local infection as well. But the thing you worry about are those systemic things and down the road, like Lyme disease. If you miss a Lyme disease, you could suffer for years, the rest of your life, really. So there's no harm in using a little prophylactic doxycycline. I've done it many times.
All right. Thank you for that question. I see, Chuck, I see your question. Stan, Lisa, thank you guys for putting those in. Miller Tribe on YouTube, what's up? Great to see you in here. If you guys got questions for Doc or a comment around any of the topics that we've been talking about tonight, go ahead and put those in the comments. Would love to share. Let's get to our last question here before we get to the live comments. What is your opinion on drinking an electrolyte an electrolyte drink mix every day, LMNT brand? I love LMNT. I think
Is that
they're
the one you
phenomenal.
got me? Is that the one you
Yeah.
got me that time? Okay.
Yeah.
That's a great brand. Yeah. I mean, if you're sweating a lot, there's nothing the matter with it. If you're working out hard, you're a sweater, I'm fine with it. Especially if you tend to have cramps. So I'm okay on it. I don't mind it at all. When I get in my infrared sauna, I usually have one along with water as well. Plus, I try to eat a lot of salt every day. So
That's a great question. I love LMNT. One thing about that brand, I think a lot of people like is I'm not sure if I don't think there's any sugar in it, which some electrolyte mixes have
great
some
point.
Sugar. So that's something to look out for.
Good point.
I'm going to put this up here from Mark. Thank you, Mark, for commenting around the ticks. Cedarwood essential oil ticks are repelled by cedarwood oil, according to recently published findings by Agricultural Research Service. Thank you for putting that in here. And then
Awesome.
D-Lynn saying skin so soft, bath oil original scent is great for mosquitoes.
I've tried it. It didn't work for me, but I have certainly tried it. and
I know
it
you've tried
works
an
well.
electric bug zapper.
Yeah, sure have. Sure have.
You have a
I've
tennis
tried all
racket one.
kinds of stuff. Yeah, hang them up and all. These mosquitoes just love me. They
Um,
don't bite Jenny at all, but they go to me every time.
Elena, you
It's
can get.
all always the mosquitoes that bite you are all female.
Oh, really?
Maybe females are just attracted to me. I don't know.
That has to be it.
I don't
I
think I've
mean,
really had that experience too much, but anyway.
Elaine, I'm looking up LMNT for you. I think it's okay. It's drinklmnt.com is
Oh,
where you get LMNT. Drinklmnt.com. All right, let's jump into the live questions, guys. Thank y'all for hanging with us. The latter portion of the show, we take live questions from the people in the comments. Super excited everyone's here. If we have any new faces, let me know. Would love to give you a shout out here. Thanks to all who are with us every single Tuesday. We do this every Tuesday at 7 p.m. Let's get to, let's see, Frida's question. Thoughts what to use for inflammation and arthritis? Does collagen and turmeric help? And if so, what brand? Also, what help with your sugar to help keep it lowered for borderline type 2 diabetic? So it seems this is pre-diabetes, probably safe to say. What's your thoughts on this, Don?
Yeah, I certainly like uh, turmeric or curcumin and collagen. I like the keto collagen because it has no sugar in it. It'll keep you in ketosis. And I usually take the Life Extension curcumin. I like that brand a lot. There's a lot of different ones. Um, so, and also, I usually like to take it twice a day instead of once a day. You're really not going to overdose on it, I don't think, unless it upsets your stomach. That's occasionally I'll see that. Um, Sugar, of course, berberine is the number one uh, nutritional supplement that I like for keeping blood sugar down in borderline diabetic. Um, Alpha lipoic acid, cinnamon are good. Of course, a low carb diet, intermittent fasting, all that. Um, Ben, I saw today something I've never seen in my 37 years of practice today. An 80-year-old new onset type 1 diabetic,
What?
80 years old. I saw him
80?
today. Yeah. He
No
came
kidding.
in and he's feeling kind of bad. And he says, I'm thirsty all the time. I'm peeing all the time. I think it may be my prostate. And plus I've lost 20 pounds, and I said, how long has this been going? He says, a couple months. So I think, let me prick your finger. His sugar was 685.
Wow.
So I had to, guess he's a type 1 or type 1.5. I ran some tests to determine that, but I had to immediately start him on insulin. So that
Golly.
was an interesting case. I even called Andy on it and got his 2 cents worth on it. But interesting
Man, that's wild.
day.
Yeah,
So
goodness
try
gracious.
that with, I like you're and get on an anti-inflammatory diet. If you have to use a prescription medicine, which some people do intermittently, I like meloxicam. Occasionally, I put somebody today on that. So don't be too afraid to use that one occasionally when you need it. So I hope that helps, and stay active. Drink a lot of water. You're on the right track.
All right, Frida, hope that helps. Let's get to Roel here on YouTube. Doctor, last week I went to my local minor emergency due to my ears being clogged. They gave me a steroid shot. I was prescribed steroid tables and I think that's right. Steroid tables and antibiotics still felt the same way. What should I do? If I messed any of that up, Roel, please let me know. But I think you get the gist.
Yeah, it sounds like you may have some eustachian tube dysfunction. which is the tube that leads from your middle ear down to your throat. You know, I just wonder what they saw when they looked at it. Was the ear red? Was there fluid behind it? Certainly, antibiotics and steroids, should help eventually. Um, you might even try using Flonase and Sudafed. Those are both decongestants. One's a nasal spray, one's a pill to kind of open you up a little bit. And I bet it'll open up for you. But I mean, if worse comes to worse, sometimes they have to put tubes in your ears. So it's both ears, and they didn't find any wax. They must have found fluid behind your eardrums. Sometimes it takes a little while to clear that up. You may need a different antibiotic. And I hate to push the steroids on you. They usually work pretty well. There's nothing locally to do for it down your ear. It just won't work. I don't know your previous history of, if you've had any problems with a bunch of ear infections as a kid or smaller eustachian tubes possible. I don't know if there's any other associated symptoms like ringing in the ears, loss of hearing, that dizziness that needs to be looked at. There's fluid. Yeah, I would say if you're not improving, go on another antibiotic and use those other things like the Sudafed and certainly the nasal steroid like Flonase. Even the other thing you could try is Afrin for a few days. Don't stay on it, but Afrin will probably open up that eustachian tube a lot.
Interesting.
If your sinuses are involved, certainly do saline nasal irrigations. But I bet it'll clear up.
I hope that helps real well. Let's let's see. I'm going to put this comment from Margot here, our PA at Fountain City. For women, you can more closely track your cycle and predict ovulation. The Ring syncs with Natural Cycles app and maybe other apps.
Yeah.
Super cool.
Great
Thank
point.
you for putting that in there, Margot.
Right.
Let's go to Lisa's question. I fell and found out today I fractured my right lateral mass at C1 and inferior C2 facet. I have neck pain and weird feelings down both arms and hands. Is this a bad thing? How do I fix this? Shoot, Lisa, I'm sorry to hear that. Man, that's a bummer. I hope you recover. What's your thoughts on this, Doc?
Well, hopefully they put you in a neck collar and sent you for a consultation with a neurosurgeon to look at that because, C1 is not one you want to mess with. That's your first cervical vertebrae. The higher up, kind of the worse it is. Especially if you're having symptoms like numbness and things, motor weakness. So the things you can do are stay in that neck collar until you can see a neurosurgeon. Wow, I'm sorry that happened. That's a serious injury. So make sure they set you up with somebody who knows what they're doing on this.
Keep us posted on this, Lisa. Keep us posted on this. We're super sorry. It's a bummer. Bummer. We hope you get in with somebody great soon. All right, let's get to Stan here on Facebook, and I'll go ahead and say Katie Gagley might have some comments on this. So I know she's a huge fan of the beef liver, which I still think I think there's a place in my life for this. I do.
Yeah, I mean,
eventually.
There's a lot of people that believe that raw beef liver is the most nutritional substance on the earth because it contains so much stuff like copper and zinc, and I mean just about everything you need. Really, if you can stomach it. A lot of people just don't like it. I think people eat just a piece of it daily, maybe one or two pieces. I know other people that just sear it a little bit, instead of eating it raw. But certainly there's a lot of nutritional benefits by eating raw beef liver. Just make sure it's organic.
I'm gonna put this up here from Katie. I believe Katie's a full-on carnivore.
I think she is. Yeah.
She's saying beef liver is the purest form of multivitamin you can take. I eat about 1 to 2 ounces daily. It's about 2 to 3 small pieces. I see a difference in hair growth, energy focus, and overall health. Best way to get copper levels up as well as B12. Super cool. Super cool.
Yeah.
That should answer Stan's question right there.
Go to Dr. Salandino's books, The Carnivore Code, and some of his blogs and podcasts, newsletters. He's an interesting guy. He has a lot of good points. He's a medical doctor, and he certainly just chew it, just
Don't
swallow,
chew it.
don't chew it. Yeah, that's a good point. Kind
Little,
of like an
little
oyster. Some people slide them down.
Yep, little insider knowledge here, guys. It's drink it with orange juice. Don't chew it. So yeah, I take kind of like an oyster in a way. If you can kind of just get over, I think if you get over the idea of what you're doing, but I'm all in on it. I think it's super cool. All right, thank you, Katie, for putting that in there. Stan, I hope that helps. Let's get to Chuck here on Facebook. I had blood work done at my primary care doctor last month. They texted to let me know that everything looked great except my potassium was a little low. What are your thoughts? Is this something to be concerned about?
Probably not. Depends on how low it is. If it's just like 3.4 and 3.5 is normal, no. But just make sure you're not taking a diuretic or something that could deplete your potassium. You may be sweating a lot. You may end up wanting to increase the potassium containing foods that you eat. You may be one that could drink an electrolyte drink every day like that. You may sweat a lot. I don't know if it's a medicine that's causing it. Could be, but if it's just barely low, I see that all the time and don't think much about it. So it's probably not major if they didn't want to get you back. One thing I would probably do if it was anywhere off at all, I would just check it back in a month or so after trying to maybe eat some spinach, but I don't like bananas much, it's too sugary, but there's other ways to get potassium. Maybe a good electrolyte drink and just follow it. But unless you're on a diuretic and need potassium pills, then it's probably not going to be a big deal. But interesting.
All right, Chuck, I hope that helps. Let's get to Deborah here. Any suggestion on what will help with coughing? Past few days having lots of coughing, especially after eating and when lying down. Taking Zysol, thinking allergies. Got up with laryngitis this morning. Any suggestions? What's your thoughts on this?
Sounds like to me you have GERD, reflux. Especially if you eat and lay down, that's GERD. So you could certainly, unless you're coming down with bronchitis or, it is allergy related, but it sounds almost classic for GERD. You can get hoarse with GERD as well. So what I would do is, take some antacids. My favorite one is Pepcid Complete. Now, if it's really severe, I don't mind you taking omeprazole, Prilosec for, a week, maybe even 2 weeks to calm it down, then get off of it. I don't like long-term use of that unless you have something like a Barrett's esophagus, but certainly use some antacids like Pepcid and see if that doesn't help. Don't eat and lay down. You may have a little hiatal hernia, like 50% of us do, and see. But, there's a lot of allergies out right now. A lot of things are blooming too. So it could have been precipitated by that and made your GERD worse from drainage. So I don't blame you for taking Zysol or Zyrtec. Again, if you start coughing up things, you may be getting bronchitis, you may need to add an antibiotic. We'll see, but that's a great comment. Classic GERD.
All right, Deb, hope that helps. Hope you start to feel better. Let's get here to Miller Tribe. I know this is it's a very common question, and we have some of our team in here. If you guys have any suggestions here, it's a struggle for everybody. I think. I'd like to know how to get insurance to approve prior authorizations for Mounjaro/Wegovy. Robin and I have tried everything we can think of. I miss Mounjaro so much. Any thought? I know you're probably
Yeah.
hearing this a lot in office as
Oh
well.
yeah.
What's your
If we
thoughts?
knew a better way, we'd believe we'd be doing it. We battle with that every day. You know, they used to cover Ozempic for a lot of people, but now it's tough. Wegovy is Ozempic approved for weight loss. It depends on what kind of insurance you have. Some are better than others, but certainly you have to have a BMI of over 30 or a BMI of over 27 and one co-founding risk factor like hypertension, diabetes, increased lipids. So, we've had more luck going to the specialty pharmacies with this. Some of the ones here in Kingsport are the Walgreens at the hospital. There's a pharmacist there that is pretty good with it, but again, a lot of times they just won't do it. Mounjaro, forget it. I mean, unless you're a diabetic, just forget it. They're not going to cover it for weight loss. But they are coming out. They're Lilly, and they're going to come out with a weight loss Mounjaro. It'll just be called something else, but it'll be the same thing, and hopefully get coverage. So there's hope around the corner for this stuff. Certainly there is the compounded stuff you can also order. It's not cheap either, but it's a lot less than the branded. But yeah, these are, like I say, these GLP-1s are the drugs of the century, in my opinion, of this century. They're the drugs of the century. They do a ton of good stuff. If you go back to last week's podcast on the Wegovy, I talk a lot about that. But so don't give up hope. And it's for certain people, it's going to be a chronic medication, not just to take it and lose 15, 20 pounds, but you have to stay on it. But insurances are notoriously hard to work with on this. And there's a shortage anyway of it. And it's been a mess, but just things are going to get better.
Yeah, I'm very interested to see kind of what happens with that. And there's been a lot of innovation around semaglutide being one, a lot of different ways to go about it. But man, the popularity of it's just, crazy. And I'm sure they just weren't prepared for it. Or speaking of like treating it as a chronic disease, you're big on getting people off their medications, and yet with something like Ozempic, Mounjaro, you're saying it's okay to stay on it. Like, why is that? Is that because the weight loss helps them get off so many other medications? Like,
Yeah, but we got to start thinking of obesity as a chronic disease that's treated daily, just like hypertension. It's not so much of a lifestyle thing as it is a metabolic disease. And a lot of it has to do with that GLP, glucagon-like peptide, and you put out by your gut, and works with your brain to say you're full. And it's a complex metabolic disease. So a lot of times, in my experience, people that get on this are very successful. They get off of it, they gain a lot of weight back. So in that case, assuming you've changed your diet and you don't eat a lot of carbs, to me, a lot of it's in the carbs, then you may need to be on it more of on a chronic basis.
super interesting. Super interesting. If you guys want to learn more about kind of his take on obesity, last week's Common Sense MD talks a lot about Wegovy in particular, and the GLP-1s. I think we've gotten to, thank you, Katie, for getting to the beef liver question here. I'll put this up. This is in regards to beef liver. Seems from Food City there. Answers Stan. We're about ready for the real show, which is Dr. Ike and
Oh, you
Izzy.
ready?
Is Izzy
I'll
doing
try
okay?
to text and see. Izzy's doing great. Izzy's doing great.
One question I had for you. I see the live on air sign in the back, and I was
Oh
gonna
yeah, do you like that?
make a subtle comment around,
You
the
like that?
guitars and
Yeah, what do you think?
live on air. Like, do you ever do any
Mhm.
recording back there? Recording
Guitar
any?
recording. I do little sessions work for some of the artists around the Tri-Cities. I wish I did. No,
If
I'm not
anybody
quite
needs
that
any,
good yet.
if anybody needs any session work, um, uh, Dad does it. Dad
I
does
have
some
my own
session
little. Oh,
work.
Ike is right here.
There's
Yeah,
Ike. Ike's ready.
yeah. Ike is
For,
all perked up.
for those new to
Hey,
the show, we end each episode
where's your little sister?
with Ike here and Izzy. Ike's the
Yeah,
gosh, well, not a it's a Bernadoodle.
Bernie Doodle. Yeah, and here so is Izzy.
Izzy's.
Here she
There we
is.
go.
Hang on.
Golly, she's
She's
growing.
a cutie pie, isn't she?
Look at Izzy.
Yeah, they really get along really well.
That's the new addition right there. Amber, I knew you were going to wake for Ike and Izzy, and I'm sure Steve, I knew it too. I knew it. You guys were asking these amazing questions just to get to Ike and Izzy in this portion of the show. Ike the MVP.
Ike gets a little jelly of Izzy a lot of times.
Do you think Izzy thinks we did okay tonight?
I think she does. She's really having a great time. This dog is amazing because she will go straight into her cage at night and sleep. Ike would never go in the cage. She sleeps the whole night. And now I just open the back door and she goes out the back, uses the
I think
bathroom. She's an
I think
amazing dog.
I think some of that is because she had Ike to look at, so she can follow and see what he does.
I think Ike's teaching her well. I really do.
Ike's a
Yeah.
good little big brother.
Yeah, he really is. He really is.
All right, you think we did okay tonight? The show was good.
I had fun tonight. Yeah, I think we got a bunch of good questions.
We had amazing questions as
If
always,
anybody
guys.
has ideas about future podcasts, I like that Roel mentioned the CPR and some of the stuff like that. So look at today's podcast on handling emergencies. I hope you like it. Everybody needs to look at that and tell your kids about it, especially about the automobile accidents and at intersections. That's, that could save lives. Look at the stats on having fatal car accidents at intersections and how you can prevent that. But anyway, I think she wants down.
Reedy, I see you. What's going on, Reedy? It's so good to see you, man. It's been forever since we've gotten to hang out. I hope you're doing well. Great to see you, man. If you guys have suggestions for upcoming episodes of Common Sense MD or Explain This, please put them in the comments. We're going to go through those later on this week and start another recording block here. So put those in the comments if you want to Doc or Robin or any of us to go over a little bit more in depth here with some of these topics.
Yeah, look at Robin's great talk on MTHFR.
Yes.
I have the mutation myself, both of them. So it's very important. It's not something a lot of people know about.
If you guys have not watched the MTHFR video with Robin, please do. It's super in depth, but also super understandable. Watch it a couple times. It'll really open your eyes to what the MTHFR gene is. We talk about it a lot, and I know you hear about it. You might even have it and not know exactly which one you have. There's different types of it. So definitely check that out. And one other thing, if you guys have not signed up for Performance Weekly, sign up for Performance Weekly. We send out a weekly email newsletter every single Tuesday with all of our best content in one place. So do that for us. Guys, this has been awesome. Thank you. Doc, thanks, man.
Ben, I hope you have a great night. Thank you. Good job.
Huge shout out to our team. We've had a lot of our team is here. I see Katie, Robin, Margot, Amber, Montana. Thank you guys so much for hanging out with us after a long day in the office. It means a ton to us. So thank you so much and being active in the comments. To all of our regulars out there, thank y'all for being with us every single Tuesday. To everyone who is new tonight, thank y'all for being with us. Hope to see you guys next week at 7. We do this every week. We answer health and wellness questions 7 p.m. Tuesday. Might have to add a taco segment to go along with the Tuesday theme.
Where do you get a taco in Fountain City? Is that talking about tacos in Fountain City?
I think there's plenty of taco places in Fountain City.
No, so there's not one that you really love.
I haven't been to anywhere other than Chipotle, to be honest with you. But I'm gonna have to find one. All right, Pop, we out of here, man.
All right, Ben.
Guys,
Have a good one.
thank you guys. We'll see y'all next week, Tuesday, 7 p.m., answering your health and wellness questions. Thanks to Ike and Izzy for showing up as always. Love you guys. See you, Pop.
All right.
Don't go away.